There we go. Okay. Ready to go?
Yep.
All right. Hi, G. It is really great to see you. We've known each other for several years now and first met a little under 3 years ago. You'd been struggling with chronic headaches for quite some time at that point. Can you tell us a little bit about what was going on?
Yeah. At the time I came to you, it had been 6 going on 7 years of nonstop headaches. I've always had headaches my whole life, but they were episodic and they
Mhm.
were, related to menstrual cycle or, I was a clencher. And so that would cause headaches or things
Yep.
like that. But they were very episodic. And then they became nonstop around, now it's like 8 going on 9 years ago.
Got it. And any sense as to what happened there? Was there some kind of event that triggered this, do you think?
I mean, now, of course, hindsight, I think that it was an injury that I sustained playing a full contact sport of roller derby.
Mhm.
It's a very adrenalized sport. And so when you get hurt, you don't notice it in the moment. You don't feel it actually for often several days afterwards.
Yeah.
But I do remember getting hit in the jaw and then another hit in the jaw and
Yeah.
just thinking, remember this because something might happen.
Hmm.
And so I did remember it. I couldn't tell you what day it happened on. I didn't write it down. I just in my
Yeah.
brain, I was like, don't forget you got hit in the jaw.
Yeah. Makes a lot of sense. So, by the time you and I had met, which was in August of 2023, um, you'd done all sorts of medications and all sorts of conservative modalities and seen a lot of doctors, including a lot of neurologists, right? And what was the upshot of all that treatment? Where were you at?
It was helped zero. I mean, not at all. In fact, a lot of the drugs they tried to put me on just had worse side effects than
Mhm.
what I was already experiencing and didn't help the pain. So I
Yeah.
was like, well, this is just making life even more miserable. But
Right.
they very confidently, even with my history, just immediately said, you have chronic migraine. It was not even, I was like, yeah, but I've never had migraines before. Why now do I have chronic? But it was
Yeah.
just a,
Yeah. It's amazing. No headaches like that before injury. You have chronic migraines. So,
yeah.
yeah. Anyway, at the end of the day, at this point, because we wanted to be very conservative, we did a series of three operations, at first on the temple,
Mm-hmm.
and then in the back of the head, and then ultimately in the four nerves in the front of the head. The first one was literally about 18 months ago. The last one was about 8, 9 months ago.
Mm-hmm.
I know that's a lot of surgery, but generally speaking, and they're all a little different. What was the time around the operative experience like? Did you have a lot of pain, a lot of nausea, a lot of numbness, a lot of dysfunction?
Mm-hmm. A lot of nausea from the first surgery.
Hmm.
Um, and then I think from the second as well. And then we figured out, you've
Hmm.
you figured out that way. I don't remember what it's
Yeah,
called, but maybe you could talk about that, which totally helped
yeah,
immensely
yeah.
when we did the alternate way of
Right.
putting it under.
Yep.
And then, the surgery itself from the first one, it was, I had a distinct vice grip feel for my temporal
Hmm.
stuff. And
Yeah.
it was just, I woke up and it was just gone, never to come back. I mean, I still had pain, because I still had all the other stuff going on,
Right.
but that vice grip feeling has not come back. Um,
Right.
that
Uh,
was amazing.
and by the way, just so you know, and to refresh for people who don't know, that alternate anesthesia technique is called TIVA, which is TIVA, meaning total intravenous anesthesia. We were able to do that in the frontal nerves because there's a lot less manipulation of the head back and forth, and certainly unlike when you operate the back of the head and you're face down, it's a safer thing to do in that case. But you really have minimal inhaled general anesthetic, which often is when people have nausea, is what causes that. And so it can take a little longer to wake up, but the nausea is almost non-existent, as you've seen.
Yeah.
Um, so just for your edification as well. Uh, but at the end of the day, we're now, like I said, 18 months from the first operation and about 8, 9 months from the second one. Tell me a little bit about where you are today. What's going on? What's changed? Better, worse?
Yeah. I mean, everything is so much better. I'm not pain free yet, but now I'm able to see where I still have issues. So I definitely have some TMJ issues I have to work on, but I couldn't even address that before because just this was so painful. Everything else, it's all I could deal with. But I went from having severe debilitating pain. I couldn't drive. I could barely work. If I worked, I was exhausted. I was the main cook. I couldn't cook anymore. I couldn't go to the grocery store. I was just had such, and I was also very active, and that just kind of came to a screeching halt. And now, after the 3 surgeries, each surgery, I felt like I got a bit more of my life back. But after surgery 3, it was my family just couldn't believe the change in me because I mean, and it happened pretty quickly too after the surgery, even though I was still dealing with, post surgical.
Incisional pain, yeah.
It was just, they were like, you are human again,
Yeah.
so.
Well, that's so lovely to hear. And I think that so many of the things that you said are so important. I think it's definitely not uh, an operation where in many cases you just wake up and everything's better. There's incisional discomfort. Sometimes there's nausea and vomiting because it is a real general anesthetic operation in most situations. Um, but at the end of the day, with a little bit of time, I think it also highlights the fact, and we were talking about this before we pressed record, that you felt like it was night and day and that you didn't realize how much pain you were in until you were out of the pain.
Exactly.
And I think that's how you put it. And I think that's again a really important thing to keep in mind because I think so many people just kind of get used to that existence and that level of discomfort. And I guess the one message I would give to people is you don't have to suffer from that. I mean, there's always options. Not everyone's a candidate for surgery. Not everyone does as well as you have. And some people don't get any benefit from surgery, very few, but that can happen as well. But at least it's an option and something to consider. And our approaches continue to get better and our results continue to improve. So
Yeah.
I'll give you the last word if you have anything else you want to say.
Yeah,
Um,
I'll say that when I was making this decision, it was really hard because, of course, insurance doesn't cover it, and your doctors are telling you, acting like this isn't a thing that really exists. So you feel a little gaslit, like a lot
yeah,
gaslit.
yeah,
Um, and then you're like, okay, I'm just desperate because nothing's helping, and this sounds like what's going on with me. And then I think for my case, I was coming in with this idea that you could find the nerve and then it would be done. But I had a more complicated case in which I had multiple areas, and so that's a possibility. I just hadn't really occurred to me that that could be the case, that many areas on my head would have compressed nerves. And from what I remember, pretty much every compression point that could be compressed was compressed on me.
that's right. That's right.
So
And I think that speaks to the kind of physical nature of the roller derby that you were participating in for so long. And I've seen that in other, high level athletes, professional football players, Division One soccer players who, go up with their heads a lot and get bumped around
mhm.
on the pitch. So but yeah, no, listen, I'm so glad that you're doing so well. And most importantly for right now, I'm really grateful that you've given us a little bit of your time and been willing to share your experience. Um, as I always say to everybody, the door isn't closing now. So if anything ever happens, feel free to reach out. But I'm really glad that you've got your life back, as you said.
And
So
thank you so much.
pleasure.
Okay.